What about children's vital signs? Just like for adults, the measurement of vital signs, an important component of assessment, includes a heart rate, respiratory rate, blood pressure, and body temperature. But you have to remember that the normal parameters for children will vary according to size and age. Other factors that can affect measurement of vital signs in children include emotional state, overall physical condition, the equipment used, how it is used, movement, and any underlying disorders. Heart rate is measured apically for infants and small children, and for all children you should count for a full minute. Tachycardia is a common sign indicating acute illness or stress. Bradycardia usually reflects poor airway control, so it requires immediate attention and possibly CPR. Respiratory rate should also be counted for a full 60 seconds. You must also observe respiratory effort and note any signs of respiratory distress. Blood pressure measurement can be affected by a variety of factors: time of day, age, gender, size, activity level, medications, emotional state, physical condition, and equipment used. Usually, blood pressure is measured in the upper arm or the lower leg. It is very important to use the correct size cuff. The cuff bladder should cover 3/4 of the child's upper arm and completely encircle the arm or leg with overlapping. It is important to remember that hypotension is a late sign of inadequate circulation in children, so it requires immediate intervention. Temperature is measured to identify the presence of fever, of course, but hypothermia is also very important when caring for newborns. Cold stress in a newborn can cause metabolic acidosis, respiratory distress, and hypoglycemia. A rapid rise in temperature can cause febrile seizures in some children. When a child has a fever, you document and report that finding and implement care to reduce the fever and provide for the child's comfort and well-being. Keep in mind, however, that fever is not an illness, but part of how the body fights infection. It does not necessarily reflect the cause or severity of infection. So how do you measure temperature in children? The rectal route provides an accurate core body temperature, but is contraindicated for children who have bleeding disorder or cancer because of the risk of trauma. To take a rectal temperature, you'd insert the lubricated thermometer into the rectum no further than 1/2 inch for infants and 1 inch for older children, holding it in place for 3 to 5 minutes or until the electronic thermometer emits a signal. It was previously recommended that a newborn's temperature be taken rectally to check for anal patency. This is no longer advised because of the risk of trauma to the rectal lining. Anal patency is confirmed by physical examination and passage of stool. Axillary temperatures are only slightly lower than rectal readings anyway, so they are the preferred route for newborns. To get an accurate reading, place the thermometer under the arm with direct skin contact for 3 minutes, or until the electronic thermometer emits a signal. While a tympanic reading is also considered a core body temperature, the accuracy of this route is probably the most affected by technique. You have to get a proper seal and have correct placement to get a valid reading. To do that, you have to straighten the ear canal, pull the ear down and back for children up to 3 years of age, and up and back for older children. Tympanic thermometers are best used in children older than 3 months. The oral route can be used for children who are able to hold their thermometer under the tongue, without biting on it or removing it. Usually, by the age of 4, this route can be an option. Exceptions are children who have had oral surgery or have seizures. Mercury thermometers should be phased out of use, as mercury exposure from breakage represents a significant hazard to clients and caregivers, and also creates hazardous waste that is costly to clean up and dispose of. Some healthcare facilities still use them for clients on isolation. Most facilities use electronic thermometers for routine use, and inexpensive digital thermometers are also available for personal or family use.